Welcome to Pacer Nursing Power Hour, your go-to spot for real tips and real talk in the world of nursing.
So plug in, scrub up, and let's go. This is Pacer Nursing Power Hour, where students get powered up. Okay, I
And
don't like this. I don't like this not being
I'm
together.
having trouble looking at your face. It's like
I
I just
know.
want to laugh. Like I just want to smile and goof
I
off.
know. Like I see your face, and I'm like, no, she needs to be here.
No, that is my bad. I am with sick child.
The flu has hit the Keigans
know.
household.
I don't like it at all. I, since probably Friday, have been in sweatpants, no makeup, and crazy hair. And I've only put on makeup and just curled my bangs and threw the rest into a ponytail
And not gonna lie,
just
all
for
those
this.
forums of health, I looked at my hair and it was like barely. I had I had pajamas on below. I'm like, I'm so sorry, you guys, but it's snowing and I'm freezing.
Yeah, no,
I don't care.
I know. I need
I
all the
don't care.
layers, all the things. Yes, but we survived the South
We're
Carolina snowpocalypse.
snowpocalypse 26.
Mm-hmm. Check.
We're
Check
pivoting
that
and
box.
changing. Pivot change
Now, yep. Now it's time for summer. We can
for
just
real.
boop.
For real.
We can go back to 80, 90. I'm even fine with 100-degree. I like hot. Let's
Yeah,
just do it.
freaking groundhogs.
What did they predict? I didn't watch.
More winter. All of them. I warned everyone to put an umbrella over those stupid freaking groundhogs when they came out so
Unacceptable.
they wouldn't see.
I mean, really?
But did you know we found out there's more than 3, but I
Yeah.
found out there's 3. There's
More than just.
Punxsutawney Phil, the OG, but
Yeah.
then there's Chuck in Staten Island.
Oh.
Chuck's accuracy is way higher. But then we also have a General Beauregard Lee in Jackson, Georgia. Fun fact.
I feel like we need a field trip next year.
I know.
We watched one ceremony one year, and it was enlightening.
Like, I
It was
want to go to
enlightening.
Philadelphia or wherever
Yeah.
they do the Punxsutawney. I
Yeah,
guess it's
let's do it.
Punxsutawney, Philadelphia.
Let's do it.
I mean, Pennsylvania.
And then we're going to have a word with the groundhog prior to his entrance, and he will know we do not like.
Oh, yeah, we dived hard into, like, how much does a groundhog weigh? Because Beauregard Lee is thick.
Yeah.
He looks like Uga.
Well said.
Yeah.
That is funny.
Yeah. All right. So what's our topic for today?
This week, I am not going to say I'm excited about this week's topic. It is a fantastic topic. However, I'm sad that we even have to have a conversation about it.
It really it's very sad too. It irritates me though because we've been talking about this for decades.
Seriously, this is not
Hadn't
like
gotten any worse.
happened
Hadn't gotten any
yesterday.
better. It's crazy.
Yeah, so we are hitting rural health, social determinants of health, and equity today.
And I know
Big
everyone's
topics.
yawning because they're like, "Oh my gosh, that's all we talk about in class." But it's reality.
It needs to. It
Yeah.
needs to. We need to make some changes. So I know I've been in situations, I don't know about you, but I've been in situations where I'm being told I have orders for discharge for a patient, but I know deep down in my gut, in the back of my mind, in my heart, this patient's going to come back. Like, they're not going to meet that month mark. They're not going to be able to follow the plan of care that we're providing. And I mean, have you ever felt like that?
All the time.
Yeah.
And
So
that, you know,
yeah.
it really is why we're seeing so many readmissions. It's why ERs are overloaded.
Mhm.
We can't
Yeah.
empty out our ERs because people are coming back because that's their only access to care.
Yeah.
Sad.
Well, this is what that episode is about. We are looking at some data, having some conversations about what we can do starting in nursing school, what we can do to make a difference and make positive change moving forward. So some not so fun facts. I looked up 1 in 5 Americans live in rural areas. One in
Yep.
five.
Yep. And it's
Bananas.
higher in South
I was about
Carolina.
to say, in South Carolina alone, that number has to be drastically higher. However, here's the catch. Only about 10% of physicians practice in rural communities.
Yep. And they have what's called deserts, healthcare deserts,
Yes.
which
Um,
is insanity.
yeah. So we have rural patients, and a good number of them that often have these greater healthcare needs, higher risks for health problems, and yet we don't have the resources to meet the demand, which
I
is
mean,
where the root of the problem lies.
we have a town that's like 20 miles from us that has no primary care at all, no acute care at all, not even a CVS Minute Clinic. They have one EMS substation. And if that EMS picks somebody up, they're out of service for 3 hours. So if somebody else has a heart attack in that town, just go ahead and plan that ceremony because, it's going to take another EMS crew an hour, if not, to get there.
It
It's
is it's
insane.
it is
It
insane.
just, and it drives me crazy. And
Mhm.
this is a conversation that's even happening at a not just local level, but we see it state and nationally.
Yeah. I
And
mean,
it's
1 in 5 Americans, that's like a big picture problem. Like, and I
yeah,
know there's people that want to live in those rural areas for reasons, but we still need to be able to provide options for adequate care,
yep.
in my opinion. So,
It's
such a
just
challenge.
it's frustrating.
Yeah.
I can't imagine. My primary care, I have one, but it's quick.
That's good. You're a nurse with a primary care. That's good.
Yay me!
Good job.
But I have old lady issues, so I have the pharmaceuticals. Um, but I'm impatient too. So if
Mhm.
I'm sick, I'm going to Minute Clinic. I mean, that nurse practitioner knows more about me than anybody.
I love it. I love it.
Her name's Rebecca with a K.
I
Thanks,
love
Rebecca.
Rebecca. I'm friends with Rebecca. I love her. Mhm.
She's amazing.
She is amazing.
I
And side
told her,
note, she travels to the coolest places in the whole wide world. Like, I just want to
shut
be in
up.
her suitcase all the time. Yeah,
All right, I need to
that's
go.
a side
I
note.
need to be sick so I can go see her and ask her
There
about
you go. I love it. Well, I think we need to start with defining what rural even means,
it.
which I'm
Okay.
terrible at even saying that word. So if I ever tongue twist throughout this, that's my bad.
Yeah.
But a lot of times we base it off of population density, but we can also look at it as distance to like a hospital,
Like
or
a
yeah,
travel
like
time.
the miles to get to care,
Mm-hmm.
and how many resources are available that give you access to services in an area. So there's many rural areas that are medically underserved
Mm.
areas. We call them MUAs, or we have health professional shortage areas. And those then just kind of collide and cause lots of problems. So you and
It's
I
like
have
the
actually,
perfect storm.
yeah, yeah, not a good storm at all.
Mm-mm.
It's not just a weekend snowpocalypse. This is a long-standing problem.
All right, but wait. Let's talk for a second.
Yeah.
Aside, I go off on tangents, but
Yeah, sure.
talking about this snowpocalypse with healthcare access,
Oh, scary.
there's been a lot of like negativity I've been seeing on social media
Mhm.
about um nurses aren't getting, critical pay for working in the snow and they have to go to work and they slide through work. Well, I understand all of that. Yeah. I was of that era where they came and picked us up. But again, that's what we sign up to do. We have to be that. And um I get so kind of upset when I hear a lot of like negativity out there. This is our job. We know that we're going to have to work weekends, holidays, days that we don't think we're going to get there. I mean, there have been days when I've gotten into work on a wing and a prayer and even got a ticket because I just kind of abandoned my car because it slid into a spot. But I'm like, I'm here. I'm a body.
So I
Um,
see both sides of it. Um, yeah, I would do everything I could to make it to work, but I also feel the opposite. Like my family's my priority, you know? And if it's going to risk me making it to work safely, I mean, I'm not going to put my own life at risk to go take care of others, you know? So I
See,
see both sides of it.
and then I'm going to argue that because the one time when I worked in a facility on the coast, I had to send my husband and young children away, and I had to stay at the hospital, and I was getting on a bus with ICU patients, and we were going to Columbia.
I
That's
just don't.
it's part of what we do.
No, no, we don't. I mean, I think my nursing is ingrained in me and it's part of my career. But yeah, I'm not going to put myself at risk. Absolutely not.
I
We can totally agree to disagree. I mean, we can talk
absolutely.
about this for days.
I
Absolutely agree. There are some individuals who use it as an excuse. I mean,
Mhm.
I didn't. My roads were fine the next morning. You know, I see both sides of it, but I'm definitely my babies need a mom.
Well, and this is a lot of reason why too, where I think we have these, areas of that are in dire need
Mm,
because I think most people don't want to be in that kind of, you live in the rural area because you love it, but then you don't get a lot of people that want to stay and do it. Does that make
yeah,
sense?
yeah,
I didn't
yeah.
say that right. I don't think.
No, I mean, there's definitely perks, especially for healthcare workers. I mean, a lot of fields in healthcare, if you work in a rural area for a couple of years, you get all your student loans paid off. So there's definitely perks. And so you will see, especially in the hospital setting, there will be physicians or nurse practitioners that come do their time and then they're out, you know?
But then with
Um,
nurses, what's going to happen in summer when the OBBBA passes? Then that nurses won't get I mean, so there's so many
yeah,
factors
there's so many. Yeah, it's
that
definitely
play into
multifactorial.
why it's happening the way it is. We know it just is aggravating to me because this is a conversation that I remember talking about when I was in nursing school. Fast forward 30 something years later.
Yeah, and it's
We're
still a topic of
still here. It
conversation.
is still
Hmm.
a major topic for healthy people. We were addressing it with Healthy People 2010. I mean,
Hmm.
come on. And now we're at 2030,
Mhm. Same
which I'm sure
conversation.
2040 is going to hit soon.
Should be. Yeah.
hmm So I don't even, am I going to be alive in that then? I don't think so.
Stop
I,
it.
I'm not sure I want to be.
Stop it.
Can you imagine writing that on paper?
I don't need to find another co-host. You're gonna be around, okay? You're gonna be around.
February 2nd, 2040.
Yeah. Yeah.
That's in
Well,
16 years.
yeah, it's
No,
not that far.
I don't want to be that old.
OMG. It's fine. Just keep doing the red light. It'll be fine. So, another statistics, which you might know this better than I had to look this up. I could find a stat that said over 140 rural hospitals have closed in the US since 2010.
I don't doubt that. I mean, we see it. We've
All the
seen
time.
it in our
All the
area.
time. Not far from us. Yeah,
Yeah.
not far from us. And then, I have to throw my own passions in there. And you actually did some research on this recently. OB units are specifically being affected, and many rural counties
Maternal health.
have
eh,
no labor and delivery services.
Yeah,
None.
and I mean the maternal healthcare deserts are even worse than just any deserts. There are women. I was reading statistics in the study we were doing, especially and you can understand it kind of in Texas, but also in like North Dakota, where that population is not dense. It's very sparse.
Mhm.
Alaska, massive travel times, just by the force of the territory. But also, South Carolina is like seventh worst. Seventh.
Yeah.
And we
Yeah,
were
we don't
looking at
have to take a
52
sled dog anywhere.
territory.
Like, I mean yeah, no, it's terrible. So in our area in particular, there were a number of physicians that retired or whatnot, in the area, very close together. Our biggest office has
Yeah,
2 main providers, like 2 OBGYNs that come and deliver babies in our area. But you have to factor in how many surrounding counties they're serving. And our rural health service clinic has had um some like there just hasn't been a stable group, especially in OB, and it's problematic. I mean,
yeah.
there are women that come in, they have no prenatal care when you're caring for them while they're delivering their baby. You know nothing. You're going in blind, and that can be scary. Very,
And we
very
all know,
disturbing.
I mean, you and I both triaged those women who are
Mhm.
9 months pregnant and has had no prenatal care whatsoever.
Yeah,
You don't
none.
know what's about to come out of the
Mhm.
chute, so to speak.
You really don't. You
I'm
really
like,
don't.
oh,
And you can't anticipate the needs of the mom and the baby, but the needs of the mom also. And it can spiral out of control real fast. Real
yeah.
fast.
And we talk about healthcare expense. I mean, a lot of this is because of the overhead of, having these and liability, especially with
Mhm.
OBGYNs, because that
Mhm.
liability never goes away. You
Yeah.
know, most all physicians at some point after so many years, they can't be held liable for any kind of or, bad outcome. Not with OBGYNs. That's a
I I
lifetime.
think the delivery is 7 years, I
But
think, but
but
don't quote
the
me on that.
impact of the baby or like
Right, right, right,
it
right, right. Yeah,
that
yeah, yeah, yeah.
never like, so
Yeah,
if they were born with congenital defects and
yeah,
something
that's
went
a
wrong,
life-saving problem. Mhm. Yeah, I see what you're
yeah.
saying.
I mean, I can't even imagine the cost of that liability
Mhm.
insurance.
Yeah. Which, is a great segue. The the health profile of an average patient that lives in a rural population, those patients have higher rates of all sorts of things: heart disease, COPD, stroke, diabetes, and they have in those rural areas have higher maternal and infant mortality rates. We just talked
Mhm.
about that.
Yep.
And then higher suicide rates as well.
Oh, I didn't know that.
Yeah, so
Well, I mean, you can almost understand it kind of isolating too.
mhm, for sure. And I don't think that rural patients, they're not healthier because they don't want to be healthier. I don't think that's the problem. I think they're just getting caught later. They don't have
Mhm.
access to care or I mean, I know there's some primary care offices. I see patients all the time in urgent care that say, "Oh, it's going to be 6 months until I get into
Yes,
primary care." And I'm like,
that
OMG, like,
that
okay, well, then I need you to come back so I can follow up on your blood pressure for the next 6 months. Like, like it's so
it's
stressful.
and
Being on the provider side is a lot of responsibility.
And then, if you're not a primary care, you're like an urgent care doctor
Yeah.
or
I mean,
ER.
that's the role I'm in.
I mean,
And I'm
I
having
remember,
to pretend kind of like play primary care
yeah,
for
but
short terms for a patient.
then at some point that jacks up visits or ER
Mhm.
visits, and it
Mhm.
takes, bed
Yeah,
capacity
it all
away.
bottlenecks. It all
And
bottlenecks.
I mean, I very distinctly remember this. You know, back in the day, we triaged, we wrote out, patients wrote out their complaint. And I remember looking at, who needed to be seen first. And there were some, a family that had some head lice. So I was like, you know, just go get an $8 bottle of shampoo.
Mhm.
They're like, no, I have to pay for that. If I
Mhm.
come here, Medicaid will pay for it,
Mhm.
and I don't have to pay anything out of my pocket.
Yeah, there's very multifactorial. That is definitely the umbrella we are under is very multifactorial.
There were a lot of politicians when I worked in the air that did not wanna be sat next to me at dinner parties.
That's funny.
My
That's
parents
funny.
socialized with a few local.
That's
They're like,
funny.
"I'm not sitting next to her. No,
Yeah.
no." They know exactly where that conversation would go.
Yeah.
We need to fix healthcare, you
Yes,
know?
we do, we do.
And that's
Well
why I think I'm so excited about this coming up this legislative day.
mhm.
While we don't have a lot of healthcare policy on the floor or on the table, so to speak, it's important as nurses that we pay attention to what's happening
Mhm.
because there are some issues that I've been reading. Because I have the South Carolina.gov app, and I can see what committees and subcommittees are meeting and what's on the docket.
Yeah, you
Um,
have to stay informed. You have to stay informed.
yes, and to
Mhm.
see just the wastefulness of time, I would lose my mind.
Oh, yeah, I could never be in that
Like, "Okay,
side of
can we
things.
just please meet here all together at 1 o'clock, and we'll be at do our business, and we'll go. No one needs to get up there and preach. Let's just vote."
Yeah. Yeah, I'm not my mind is not built for that,
But
for
I'm
sure.
so excited about Legislative Day because we get so far removed, and we try to tell our students, "You have a voice, use it."
Mhm.
You don't really understand it until you get there and you
Sure.
see. And
Sure.
I am so excited for this day. I'm
Yeah.
so excited for our students to experience it. It's gonna
Yeah.
be phenomenal.
It will be. It
And
will
this is
be.
part of it. Midwives are still on the table. There's some legislation still kind of reinforcing and giving midwives their
Mhm.
proper, like I did learn midwives don't get reimbursed. There's plenty of states that don't reimburse midwives. So I, you know, I don't, if I were a midwife, I mean, I would have to weigh that.
Mhm.
But their hearts are. I've just found anyone that I've known as a midwife, that call to do what they do is so strong. I mean, like,
It
I feel
is.
like my call is strong, but even you said we have our boundaries. I'm not putting
Mhm.
myself at risk.
Mhm.
But these are the women that come in on a horse if they need to deliver that baby. And that's what I envision. Because the ones that I've met are truly
They are. They're very passionate.
just
They're very
salt of
passionate.
the earth and just passionate,
They are.
wonderful.
They are.
And midwives don't get their props.
They don't.
So,
They don't. Well, we are going to record an episode on policy and the conversations that are going on right now in a couple of weeks. But for today's topic, we've talked about geography and living in a
yep.
rural area, just the geography itself and what that means. But there's also what we call social determinants of health. I know my
Yes.
students hear me say it all the time. I'm sure your students hear you say it all the time. I think across the board, nursing students probably have
We
social
started
determinants of health
it
ingrained
started
in their
in
head.
level 4. It starts in level
Yes.
4.
Yes.
Yep.
So, for those that don't know or aren't in nursing school or forgot about this conversation from nursing school, social determinants of health are the non medical factors that influence health outcomes. So, that can fall into a lot of different categories. A few of those would be like economic stability, education, healthcare access. What your environment is like, social and community context, it could be a lot of things. So,
Mhm.
not just whether you get healthcare or not, but all of the other factors that are playing into your health outcomes. So, yeah, I truly believe that actually going and receiving healthcare is a very small portion of your total outcomes.
Mhm.
And that it's the everyday things that you're dealing with that truly impacts the majority of your health
Yeah.
and therefore health outcomes.
And a lot of everyone wants to throw because we do rural health. I think rural communities have greater issues with social determinants of care,
Mhm.
not just access to health care, but access to transportation. Like, they may not
Mhm.
even have a car that gets them there. We've
Yes, like
already
you said, there are towns not far from us that have to have a 30-minute drive just to get to a doctor.
Yeah.
And
And
that's if
then
they have a car.
yeah, exactly. And then you have to think about, I don't know if we've discussed it on our podcast before, but the average person, American person reading health education information that they read on a 7th grade level. But yet I was part of a company where we assessed this is called health literacy,
Mhm.
and all of our educational materials were written on a 12th grade level. So
Yeah.
we're giving these, and I just said in my class just now, for it to be deemed a foreign language, a language has to contain like 1,500 unique words. Medicalese is a foreign language. We have
Mhm.
1,500 different unique. So, we use those all the time.
Mhm.
And in fact, that's kind of what happened last week with a family member. And, I'm like, I'm here to interpret, but I'm also here to, help, anyway, but still, that people don't understand what they have a right and right not to do or to have.
Absolutely. Absolutely. Yeah.
And
So
it
for sure.
drives me crazy. And they don't know. They don't know they can ask. And they get this educational material and they can't read it when they get home.
Mhm.
So, how many facilities have actually looked at their education and
Mhm.
reviewed it for health literacy? Like,
Oh, yeah.
what?
Oh, yeah.
And then
Well,
they want us to print it off in Spanish. Okie dokie. But I have no idea what it says where in the body of that education, where and when to give Tylenol. I don't know what to circle or highlight because I can't read Spanish.
right.
And it
Right.
doesn't align with the English version.
Right.
So there's not, what's the answer?
Mhm. Other categories I can think of is access to food. Um,
Food insecurities, yes, for
yeah,
sure.
there's definitely food deserts across the nation and here in South Carolina for sure. Even
Poverty.
internet access. You're
Uh,
talking about being able to read material that's given to you. Now, a lot of it's all online. You get a link that's texted to your phone. If you don't have the internet access
well, that's the
and you can't
problem.
pay the phone bill, then you can't even see that stuff, you
Okay,
know?
so post pandemic, the answer to everything was supposed to be telehealth.
Telehealth.
But if you can't get internet
Yep.
20 miles away from here, what is that
Mhm.
going to do?
Mhm.
That's not
Yep.
going to do anyone a bit of good. If you
Mhm.
want to bring a mobile van, okay, but they are going to need Wi Fi.
Mhm.
Plus, do you have a place for this big old bus to plug into? Is
Yeah.
there a safe spot, a
Yep.
location that's not going to be a fall hazard? Or,
Mhm.
those are
Yeah.
the things that people aren't thinking of. I mean, yeah, we have these resources, but does it align with what the community has and
Right.
needs?
I've even heard arguments saying, well, people just need to go get jobs so they can afford the internet access or afford this or afford that. But then immediately think, okay, I'm blessed to have a job that I can work appointments around. But if you're working for an hourly wage to where you can afford all of those things
Yeah.
to prevent those health outcomes from happening, how are you going to have time to go to the doctor, you know? So it's very, very gray. It is a very gray area. I see both sides. It's very difficult.
And I think
Um,
that's why we can't solve for X,
yes,
because
because
we
X
can't
changes to Y, changes to Z.
conceptual abstract thinking.
Yeah, it's above my pay grade. But I'm going to keep having the conversation. Maybe someone will listen. So I truly don't think patients are necessarily non-compliant. That's actually a diagnosis, is non-compliance,
And not
and
a behavior.
it hurts me when I put that in there. I mean, if there's a patient that tells me, "Oh, I just don't like taking this medicine," like that's one
That's
thing.
one thing.
That is
Is
one thing.
if you
Now I
can't
still will
afford
ask
it.
why. Why don't you like taking it?
Yeah.
And we figure that out. That's a different conversation. But there are so many patients, especially in our area, that are facing barriers to actually taking care of themselves. And I think that's where our role, especially as nurses, not just healthcare, but as nurses, we have to start asking the whys and what can we do? And some things we can't. It's out of our hands. I get that. Um,
So here's a
but yeah.
perfect parallel.
Mhm.
So you're talking about, there's barriers to care,
Yeah.
right? Sometimes it's the patient. I was with my family member and I looked, hospitals are starting to put those ceiling tiles that says stop, call before you
Oh, yeah.
fall.
Mhm.
Okay, well, the hospital beds jut out, and when the head raises, they put the tile
At the
closest to
back.
the wall
Yeah.
at the back. But they're also targeting a population that can't see a distance.
Yeah.
It happens at night and you
When the
can't see
lights
the
are off.
sign and when the lights are off.
True.
I'm like, and then now there's this new thing I saw somewhere where one hospital is instituting like this poster to put in rooms for falling.
Mhm.
And Jeff, my husband was like, "Oh, good. That'll just help remind the nurses." I'm like, first of all, I'm going to need you to sit down because this is going to be a bigger conversation.
Jeff?
It's not that the nurses need the education. That's what we do when we're rounding. We
Mhm.
are saying, "Don't get out of bed." We put those stupid
We
yellow
point to
socks on
it.
it. You got the follow call sign way over here.
Yeah.
But he goes, "Well, it's a reminder for the nurses." I'm like, "No, the nurses don't need we know because we have to write up those incident reports and we
Mhm.
get nailed." So,
We have to write them up and we get nailed.
right. And then, so this again, the language that is used on this poster is medical terminology.
Right.
How are these patients going to be reading this?
Mhm.
It
Rawr.
I feel like we're going backwards.
Yeah.
And when you're sick, do you want to read all the posters in the
No, thank
room?
you. No, I don't.
And if you
No.
don't have a family member there with you,
That is
I
smart.
mean,
Yeah. Mhm.
can you tell
Exactly.
we need to do better?
We do. And I think we're all struggling on what that answer is.
Yeah. We've
So,
definitely seen a different world,
yeah.
and it's got to be focused on prevention.
Exactly. I like that. I like that.
We
Now
got
there's
to
a
focus
lot we've gotten so far down the hole that I think prevention is not all encompassing,
far. Yeah.
but I do think if we were to like stop the line here and start really focusing on prevention and then start figuring out how to handle all of this side of things, I think we could kind of start gaining some speed. But
And I feel like that's the world that we're going to see. We've got to, it's going to start happening. Population health is going to get more important as we grow
sure.
because A, we don't have the facilities nor the space if there is a facility or the
Mhm.
provider.
I was about to say, or yeah, the nurse giving the care. I've seen it all the time where there's beds open above the ER, but there's no one to take care of those patients. So
Yeah.
you
So,
can't
I
move them
mean,
up there to those empty beds.
we're going to have to shift.
Sure.
There has to be a shift.
Yeah.
And, our in Spartanburg County right now, how many measles cases are we seeing at this point?
Ugh, I don't even
And,
know.
and it's so ironic because our immunization lecture was about to, but I'm like, you know what? I'm not going to do this lecture because A, the CDC dropped some vaccinations from the previous immunization schedule. And then the American Academy of Pediatrics came out with their own immunization schedule.
Wow.
There's two different. So,
Yikes.
how is the public supposed to stay informed?
Mm. One of the many things we have to figure out.
See, I think we're just making the problem worse in there and everyone's who's listening's eyes because we've been around and in the system so long we can see it and we know what needs to be fixed, but we don't have the autonomy to fix it. But it starts with your voice.
Yeah. Yeah.
It
Yeah.
starts with dialogue and conversation.
Yeah. Definitely.
Like, okay,
Like
yeah,
this, like this space.
uh-huh. Yeah.
Yeah.
So, for all of you students and nurses, whoever's listening to us, don't let this conversation just make your eyes glaze over and roll back and speed through. Don't put us on 2 times the speed. Have this conversation with people around you. Like, when you're discharging a patient, is this patient gonna be able to reference back? No,
Yeah.
probably not. Do something better. Do something about it. Have conversations with your families, you know?
Yeah. Ask those questions, definitely.
I get so,
You
um,
get riled up today. You're getting riled up.
I
Rightfully so. But we do kind
it's
of keep getting off topic.
I'm sorry.
That's okay.
That's my
No, you're
claim to fame.
passionate. No, I'm passionate too. No, I think that is the motivator of this conversation today because it is such a big deal. And there isn't a great answer.
Mm-mm.
There just isn't, you know? And if we can continue to have these conversations and be good nurses, not to put it on the nurse like everybody does, all the responsibility, but
Yeah,
even just acknowledging, I mean, I tell my students all the time, you start building that rapport with the patient from minute
day 1.
0. And
I mean,
you ask those questions, you know if they have running water in their home by the time they leave. You know if they have access to something other than Dollar General or Dollar Tree food, you know? That's where then you know the resources that you can help get the
mhm.
patient in touch with versus just, oh, this is the typical discharge paperwork, you know? So I'm
Yeah,
not
here you
saying
go.
we can fix the entire problem by any means because we can't. It needs to be a collaborative effort. But I think there are things we can do to be good nurses and just make it a habit to look for these things that are just becoming a growing problem.
Mhm.
Because
Yeah.
in our area specifically, we talked about the geography, the rural health side of things. We said what social determinants of health were, and then these just have a compounding effect because you add distance and then someone who can't afford a car or food or whatever, and then you throw in some provider
A
shortages.
copay, a
Yeah, can't afford a
copay.
copay. And then they don't seek care for long periods of time. And someone who, when they first said, ooh, I think I have a problem here, or I might be diabetic and blah, 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 like I have this wound on my foot that's not healing. By the time they get care, they are being seen in the ER because they're going to lose their limb because it's gotten so bad. And if we had caught them when they first recognized they had a problem, if they did, then
Mhm,
maybe we could have prevented that. I don't know. So, yeah, I totally agree with you. I think preventative care is very frequently deprioritized
mhm.
and that's a problem. I think we need to really shift back towards that. That's not where the money is, but that's that's how we solve these problems.
It's
And
not.
then for pregnancy in particular, like we said, if you're living in a rural area, that woman is less likely to get either late prenatal care or no prenatal care
None.
at all. That spirals into more complications for the baby. That spirals into more complications for the mom. That could potentially lead to a preterm birth or maternal mortality. I mean, women still die from childbirth, which is
Yeah. Did you know
insane to me.
so we study in that case study I looked at in maternal deserts. One of the things that we looked at were factors of complications both in infant and the mom, maternal.
Hmm.
What were, if it was a negative outcome, what about the mom was a factor?
Yeah.
Things like weight, smoking,
Hmm.
um, didn't have insurance.
Hmm.
Do you know what the number one thing was?
What?
Weight. I
Yeah.
would have never guessed that. I would have said
That's
smoking, no insurance. I would have said everything but weight.
because obesity is a risk factor for so many things.
But the amount of poor outcomes that are associated with a
Mhm.
baby,
Mhm. Yeah,
it
it is
blew
mind-blowing.
my mind.
Mind-blowing. Mhm. And like you said, they aren't problems that we just fix and then discharge. These are lifelong problems
Yep.
for the baby.
Yeah.
Yeah, it is bananas, which is why
As
I
I'm
totally
sitting here
agree.
thinking about going to get a Big Mac.
You probably need it. You
No,
probably
I
need it.
need to make
Not
better
I, but
food
you.
choices. I
Yep.
need to make better food choices.
We all do. Honestly, here in South Carolina, we all do. But I
I
think
can
this
preach, but I don't listen to myself.
you're ridiculous. We'll work on it. We're
But
still we're still establishing our New Year's resolutions.
yeah, we need to find a yoga class. Or right now, I'm kind of so amped up. I'm thinking we just need to go straight to the bungee class.
Let's do it. Let's do it.
We just got to have time, and people can't be sick.
Yeah. I'm ready to be well and get back on track. I really am.
I
I'm
know.
so frustrated with my family.
I know.
But this same concept can not just maternal patients, it can be seen across the board with chronic disease.
Hmm.
We have so many complex chronic disease patients in our area,
Hmm.
and these are not a one-time 15-minute visit once a year. It's just
Nope.
not. So these are regular appointments, and then that snowballs. Can they make it to the appointments? Do they have a way to make it to the
Hmm.
appointments?
And if it's a snow day,
Yeah,
is
can
the
they
South
if
doesn't include.
I can give all the education in the world to a diabetic patient on how to eat right, but if you are just shopping at Dollar General, you're not gonna meet those requirements, what I'm asking you to do. So,
Yeah.
yeah, it's really a really difficult situation. We can't, as healthcare providers, make assumptions about patients and just put them in this non-compliance box. That's not the solution. Also, pivoting again, mental health. There are so few mental health offices
Don't
that
even get me
will
started.
accept patients. It is so hard to
I
get
can't.
accepted.
I can't go down that path because I get very angry about that.
Yeah, it is
That's where
really,
all of
really difficult.
most of the workplace violence is occurring
Mhm.
from and nurses. That's what I can't.
Yeah. Yeah,
It's so bad.
it
It
really
is
is
so
bad.
bad.
So I think it is really important that we as healthcare providers don't always put a patient in that non-compliant box. We need to
Mhm.
start asking why. And maybe
Mhm.
it is they just don't like taking a pill or they don't believe in taking this. But then let's pivot. Let's figure out another solution. Is that eating better? Is that, exercising more?
Mhm.
Cuz pills aren't the only one solution to everything either. But let's figure out really where the root of the problem lies and really start providing the right resources for patients if they need it.
Well, I'm
Um,
all about a good pharmaceutical.
I know you are. And there is definitely a time and a place. I will not argue that for sure. So at the beginning, we talked about rural health, social determinants of health, and health equity. And I think
Mhm.
it is truly important for people to understand that there is a difference between equity and equality. So,
Yes.
health equity means that everyone has a fair opportunity to reach their highest level of health. And the when I was in F&P school, the picture that was presented for this was and I honestly I thought of me and you. So I'm going to use us as examples, okay? So it would be like us looking over an 8-foot fence.
Oh yeah, yeah.
The stool that I need to look over the
It's
8-foot
shorter.
fence is
Yeah,
way shorter than the
I've
stool
seen that
you need.
picture. Yeah.
You need an 8-foot ladder to see over the fence.
Yeah.
And
No, yeah.
so we have different needs to reach the same outcome. And I think
Yeah.
that's really important to understand. I didn't understand that for a really long time as a healthcare provider. I thought, yeah, if I send home everybody with the same discharge paperwork, they're getting what they
Everybody should be
need.
good.
And that's not true. So, equity means that you are providing education and resources that are truly tailored to the patient's reality.
Which
And
also compounds onto all those barriers that we see.
absolutely.
Health
Yeah.
literacy, economic factors. Yeah.
Yes.
I mean, it's
For
just
sure.
it's a dog chasing its tail.
Yeah. But I think the nurse is in such a crucial role
Yeah.
in healthcare because we are the ones, we're doing the hand holding. We are building that rapport. We are getting to know the patient. Patients trust us. And that's so important in healthcare because they will divulge whatever they're embarrassed about, their secrets are, and we can help them navigate and truly get the care that they need to reach the outcomes that they want.
Yeah.
Um, and we've talked about finances. I mean, health inequities contribute to higher healthcare costs. If we don't provide individualized care, they are going to
Yeah.
be back. And
And
we're
that's
not going to be able to prevent hospitalizations at that point. So it really is important to address those social determinants of health. And
individual care, individualized
yes,
care is key. It's crucial.
absolutely.
Crucial.
Definitely. And I think it becomes a little uncomfortable, at least for me personally. I don't know about you, but there's definitely been times where I'm like, hey, I need to get social work involved. And that conversation with the patient, they've built trust with me, but now I'm like, okay, well, we need to get somebody else involved because this is out of my wheelhouse. And then they get a little standoffish and defensive. And that can feel really uncomfortable in a nursing home.
Yeah.
And like I said, I think it puts a lot on the nurses because we are in that role. We aren't just fulfilling orders. We're like little
Mhm.
detectives trying to figure out the root cause of the problem? And it's just
No
a
one
lot.
really you don't really understand the vast role that we play every
Mhm.
day,
Yes. And
even when we're not on duty.
yeah.
That's what I feel like is so easy to forget.
Yeah. Well, I think it's important that it truly is not our job to fix everything. And I struggle with that because I'm a fixer. I want to fix everything. And I have to remind myself it's my job to help remove those barriers or even just find the barriers and then give resources to help remove the barriers,
Yeah.
you know?
Yeah.
Um, so I know I struggle with that as a nurse. I would imagine that a lot of nurses are fixers. We just fall into that category naturally. And we do kind of have to
We're
check our,
doers. We're
yeah, we're
doers.
doers. Let's get it done for sure. So at the bedside,
I
I think it's important that we ask questions. Have you ever been
Yep.
in a situation where you're like trying to dig for more information?
And they won't talk to you. Yes, absolutely. I take care of peds, adolescents.
Yeah, that is a whole nother beast too. Like, because a lot of their choices are out of their hands, and that's a totally different skill set. That is incredible. I am not good at that. Not good at that at
Yeah.
all. Um, yeah,
Beckett, listen louder. You gotta listen louder.
listen louder. Yeah. So I think asking questions about social determinants of health are important. Like, hey, do you have a ride to get to this follow up appointment? I made you a follow up appointment, but can you even get there? Like
Yep.
simple questions. Um, or asking about meds. I mean, my mom, who I've told a million times how to like give her meds, still has questions? And I'll get the little syringes and I use the Sharpie and I mark them. And someone who doesn't have a nurse in their family, I can totally see how easy it would be to screw up your medications, even just having a
Yeah.
few medications.
Yeah.
So yeah, um, we teach all the time, like use the teach back method, use demonstration, show
Yeah.
videos, like all these things. There's so many different ways to educate, but it really just boils
Yeah.
down to good education.
Just stop and listen
Yeah.
and talk to them. Don't talk at them.
Yes.
So wrapping up,
Yeah.
let's have that conversation more. This
Absolutely.
needs to happen more. And we
Yeah.
need to do a better job when we're one on one with our patients.
Absolutely. I totally agree. Nursing has always been about caring for the whole person, not just the problem, and we need
Yep.
to get back to that.
Absolutely.
Sure. Yep. Cool. Well, as always, follow us on social media, watch all of our prior episodes, and thanks for scrubbing in with